Oh, hi everyone. I'm Dr. Sandy Wills, and I am an immunologist focused on the immune response in vaccination. But more importantly, I'm a vaccine ambassador. I believe that vaccines improve our quality of life individually and collectively, and all people deserve the knowledge and access to vaccines. And I'll spend the next 15 minutes or so on establishing the case for adult vaccination. So as mentioned earlier by Nusia, there are 4 modules for the Adult Vaccination Experiences program. I will discuss today Module 1. So vaccines play an important role in protecting your health and the health of your family and community. They are one of our best defenses against many serious illnesses and infectious diseases and have saved millions of lives. But despite the tremendous benefits of vaccines, at least 3 out of every 4 adults are missing 1 or more routinely recommended vaccines. So the question remains, why are adults missing vaccines? And what is the barrier to vaccination? So vaccine skepticism is one of the major barriers in adult vaccination. And for those who are vaccine skeptics, I understand where your concerns are from. In the past, there have been hideous vaccination atrocities around the world, but at least in the US, the US study of the Tuskegee syphilis experiments left unknowing Black men in Tuskegee, Alabama, to suffer from syphilis. And because of this and some other factors, in nearly half of the US states, Black and Hispanic vaccination rates lag, while white vaccination rates are by 10 percentage points or more. They lag by 10 percentage points. But however, because of these atrocities, protection systems have been put in place for the rights and safety of patients. That's the Institutional Review Board, the IRB, the Food and Drug Administration, the Center for Disease Control, and other monitoring systems. And I must tell you, as a Black woman, knowing this generational trauma, I'm a proud supporter of vaccines. I look at the facts and the evidence and not just the fears, the rumors, and the myths. There are some other reasons why some adults are not vaccinated. These are the fear of needles, side effects, inability to pay due to lack of insurance, poor awareness and limited investments in health promotion and disease prevention, and the lack of an effective reminder system. These are all legitimate reasons for not taking a vaccine. However, these fears and reasons take away great health opportunities from us. So there are many sources for vaccine information, and these sources can be reliable or unreliable. So unreliable sources might be your neighbor who's a police officer, a coworker, a friend's friend, Instagram, an economist, a lawyer. However smart these people are, they're not experts in the biomedical sciences. Reliable sources would be your neighbor who's a medical professional, a doctor's office, a scientist, a clinic, vaccine ambassadors, and your Department of Health vaccine and immunization sites. My goal today is to educate on the importance of vaccination in healthy aging, to highlight the health, social, and economic impact of vaccination, and discuss strategies to prioritize adult immunization. So any discussion of vaccines must start with a brief snippet into the immune system. And as an immunologist, I must share with you some of the basic concepts. So when a pathogen or a disease-causing virus or bacteria enters your body, your immune system recognizes the intruder and jumps into action. And one of the ways your immune system provides protection is by producing antibodies that help destroy and remove the intruder. Each time the immune system is exposed to a pathogen, it builds up defenses. So the next time the immune system encounters the pathogen, it has developed immunity and can remove it more quickly, preventing illness. And this immunity develops each time you get sick from a bacteria or virus. But you don't have to get sick from an infectious disease to develop immunity. You can get vaccinated. Every year, thousands of people in the US are hospitalized or die from vaccine-preventable diseases. Millions more are unable to go to work, care for their families, and take care of their own responsibilities while they recover from illnesses that could have been prevented or made less severe with vaccination. $676 billion per year in the US is the full income volume of death as a result of vaccine-preventable diseases. And while vaccinating 40% of the world's population by 2021 costs around $50 billion, its benefits could reach about $9 trillion in economic gains. Adults can easily spread diseases to others. The more people who are vaccinated, the fewer opportunities a disease has to spread. This means that vaccines not only protect you, but the people around you, such as infants who are too young to be vaccinated, or people with weakened immune systems who are at high risk of severe illness. For example, consider pertussis, also known as whooping cough. In an adult, this vaccine-preventable disease may seem like a persistent cough and a bad cold. The problem is with a young infant, pertussis often results in hospitalization and even death. And approximately 85% of infants with whooping cough got it from a member of their immediate or extended family. An unvaccinated individual who is infected can spread disease to vulnerable people, similar to oxygen and wood fueling the spread of fire in your home and community. So why not get vaccinated? The Institutional Review Board, or the IRB, has been formally designated to review and monitor biomedical research involving human subjects, and vaccines are safe and rigorously tested before approval by the FDA. The FDA and the US CDC also monitor vaccine safety and efficacy when they are in use. And by the time vaccines get to market, most side effects are mild and they go away on their own. So you need vaccination no matter your age. So I have here a list of the adult immunization checklist. So that is includes tetanus, diphtheria, and pertussis, measles, mumps, and rubella, human papillomavirus, varicella zoster or chickenpox, hepatitis A and B, herpes zoster or shingles, pneumococcal vaccine, meningococcal, influenza, and COVID. But some vaccines you received when you were younger can wear off, so you may need a booster. Also, if there are vaccines you never received as a child, it may be recommended that you get them as an adult. It's important to get the flu vaccine every single year as it's updated annually, and to best defend against the constantly changing virus, and your immunity decreases over the year. In addition, as we age, our immune systems weaken and put us at higher risk of certain diseases. And with some chronic diseases, the complications of infection can be more severe. Take heart disease, for example. Getting the flu if you have heart disease increases the stress on your heart and therefore your risk of heart attack. In diabetes, if you have diabetes, flu infection can raise your blood glucose to dangerous levels. And for chronic lung diseases like asthma and COPD, if you have impaired lung function, the infection can lead to pneumonia and other serious respiratory. By being vaccinated, you can prevent the spread of infection in your home and community, similar to a flame retardant in stopping the spread of a fire. There are some strategies adapted from evidence-based practices and implemented nationwide to help increase vaccine confidence and uptake. So these are 12 strategies to improve vaccination. First is vaccine ambassadors, who train community members to disseminate important information. Medical provider vaccine standardization, which refers to offering vaccination as a default during patient visits. A reminder recall system, which are messages sent to patients to remind them about the upcoming treatment. And there's motivational interviewing, which refers to patient-centered conversations. And financial incentives to motivate people to participate in a health behavior by providing a tangible reward and a chance at a tangible reward. Then there's school-located vaccination programs, which are events held at school campuses to remove some logistical barriers. And home delivery vaccination efforts reach populations where they live. Vaccination clinics held on sites at workplace remove logistical barriers and create norms among employees. Then there's vaccination requirements, which are policies that require employees to be vaccinated before being eligible to enter the workforce. Then there's some trusted messengers who can be trained by vaccine ambassadors and may include doctors, community, and faith-based leaders or local celebrities. And there's provider recommendation, which refers to healthcare professionals recommending that a patient receives a vaccination. And finally, combating misinformation. So this strategy consists of tactics used to address and dismantle misinformation and disinformation. So I urge you to take control of your health and make sure that you're up to date on all of the vaccines recommended. Next slide. And where to get vaccinated. You can get vaccinated at your healthcare professional's office, neighborhood pharmacy, health departments, community health clinics, and even some workplaces. And most health insurance plans cover the cost of routinely recommended vaccines, although you should confirm before getting vaccinated. So I've had here some resources on vaccination.
Thank you so much for that presentation.